Our next speaker would be Marta Gehring. Okay, hi Marta. Hi Marta, how are you?
Thank you. I see we're a bit early in the program. Great.
Yeah, that's good. It's really great. Nice shirt. Okay, so Marta, you can start to share your screen and I start to introduce you, okay?
Yeah.
Okay, because I have just touched the topic on market research, and I really hope that I could convince the audience how important it is to do a proper market research for their European market entry strategy. So now I'm introducing Marta Gehring. So Marta Gehring 是国际经济学的硕士，她有20年以上市场营销及商务拓展的经验，曾就职于包括默克赛洛公司和美顿利等跨国公司的高管哈，并担任销售区营销总监等等职务。Marta 呢是瑞士知名的产业顾问、创业导师。他其实是药品和医疗器械双栖的市场专家，他也是瑞士生物技术协会的区域负责人。那么下面呢，欢迎 Marta 给我们讲一下市场调研，就是我们中国企业如果要出海，欧洲我们在市场调研方面要注意哪些方面 ？Great, Marta, I'm done. The stage is yours. Really looking forward to your talk.
Thank you. Okay, so we're going to talk a little bit about how market research relates to your product launch or your European market entry program. We're going to look at why it's so relevant, how we can apply it, techniques to get data, a quick review on secondary and primary data, and then some practical recommendations for doing those important discoveries, market discoveries, key opinion leader discoveries to really position your product optimally, and some conclusions. So here we have a study from MIT Sloan Business School that basically says, if you want to make better decisions, you need to start experimenting. And experimenting is doing that market research to explore different ways that you can position your product. So systematically embed experiments into your organization, understand why they work or why they don't work. Make sure you deeply understand what's going on. Don't focus on the short term, especially in medical. We know that our research on needs, on positioning vis-a-vis the competition, on market access, on pricing is going to be valid for years and years. We are not testing for short-term requirements, and then aim for transparency. Let people know that you're doing this research. So in today's session, we're going to talk a little bit about key questions that innovators have, how we get answers, very important, and then practical considerations to get and interpret data. Okay, so looking at applications. When you prepare your European market entry, you might want to look at market size. You might want to look at growth potential. Very important is customer needs and value proposition. And even more important, I would say, is this ideal market segment, where to play. There are entire management books written about how to select the best segment. And in your case, coming from China, it would also be the best market, because you could launch in Germany and France and UK and Spain. That's very different. We'll talk about that a little bit more. How to get opinion leader acceptance. What about your competition? How you're going to do in hospitals, and how you're going to set your price. So all of this can be looked at. And when you negotiate with the distributor, when you negotiate with the potential partner, if you have this information, your negotiation is going to be a lot more solid, because you're going to have a market understanding. Otherwise, the European partner can tell you lots of things that you can't validate. So it puts you in a position of strength. And the value gained by improving the understanding of customer needs is central, and it's depreciated over years, because when you understand what you see on the screen, it's not going to change in 6 months. It's not going to change in 1 year. Maybe there might be a price erosion, but the fundamentals are there. So don't save on having a thorough understanding of the market. Don't save on intelligence. Now, the problem with Europe, or the challenge with Europe, is that it's a mosaic. Yes, it's one geography. Fortunately, it's one CE mark. And fortunately, we have pan-European medical societies, like the European Society of Cardiology is relevant all over Europe. That's fantastic. However, we have a mosaic of languages. We have very different medical practices in the different countries, extremely different hospital purchasing modalities and rules, completely different reimbursement bodies. We know that if we get CE mark, we might get reimbursed in France, but not in Italy, or we may get reimbursed in UK, but not in Hungary. They have different health technology assessment bodies. Hopefully this is coming to an end. Pharmaceuticals are now converging to a European HTA, and starting 2 years from now, it will be required for rare diseases and oncology. And then additional diseases will be added as you go along, but medical device is still far from that. So you might still have to go through a health technology assessment in different countries. So being very strategic in which country you get your HTA first can have a big impact on your European launch perspectives. And then, of course, different pricing rules. So the key message here is, one geography, one CE mark, everything else very different. So when you decide to launch on Europe, it's very strategic, where you want to go. And even if you focus on the top 5 countries, which are UK, France, Germany, Italy, Spain, even then 5 countries may be a lot for a launch. So you might want to launch in only 2 or 3 initially. So why we do the research? We want to understand the customer need. We want to increase the chances of success, but also the man running on the right, we want to choose which markets to invest in and which markets not to invest in. Okay, so we want to be very strategic about the market segment for your product. Maybe it's going to be used only in private clinics. Maybe it's going to be used in public hospitals that have a stroke unit and not in other public hospitals. So you really need to select your segment and the countries. And this is one of the things that we can help you with when you want to, launch your product. Where is the best opportunity for you, and where not to waste your money investing in, and where to, how to be strong and how to negotiate well with your commercial partner, because you need to know the same things that your commercial partner would know. So in terms of product launch, the key things you want to look at is what is my customer expecting? What drives customer demand? How do I minimize risks? So if there are some major unknowns, I need to know that, and I need to be able to minimize those risks. We spoke a little bit about where to play, in which segment am I going to have the greatest traction? And then who could the customer use? What product could the customer use instead of yours? So what are your direct or indirect competitors? And finally, the pricing and market access question. How should I price my product? Will it be reimbursed and high? So these are things that you really want to get straight before you come to Europe. And then how should my offering be tailored based on these 5 sets of information in order to really improve the success? You may have heard about the lean startup, and I show this only because it relates to market research. So there's 2 key things. When you are planning a new product, you constantly have to test the product, whether it is because you're developing a product or because it's a developed product in China and you want to know how to launch it in Europe. You want to validate that approach. And then down here, you avoid failure by getting information on what the market wants and tailoring your product and moving away from options that don't work or don't make sense for you. So it's really about having a hypothesis for where your product can provide value, designing experiments, doing that market research. Insight means understanding more about the market wants, and then improving your launch plan so that you're much stronger. Okay, so how do we get the data? We want the data. How do we get the data? First thing is the techniques that we discussed, secondary data and primary data. So you want to do both. So the key message here is make sure that you check really good and solid secondary data before you plan your primary. So primary research is research which is done entirely for your product. But there is a lot of bad secondary data out there, and we don't want you to waste your time on that. So secondary data is obtained from previously undertaken research, gives you a broad understanding of the market, and it's not specific to your business, and it helps you to prepare for your primary research. Here I just put some business sources for secondary market reports. Look at the trade journals, for example, what is being written by European Medtech, Medtech Europe, what is written by the different associations, specialist providers like top consulting groups, McKinsey, Deloitte, E&Y continue to produce very good reports on healthcare system in Europe. Sightline is a new company that has acquired a bunch of market intelligence companies, including data companies, so you can get any data on any product from them. They're basically have been consolidated by private equity, and they're very strong. And then, of course, your medical resources. Just want to mention McKinsey because they have a huge amount of reports. This is an example. You can find out about how to sell in public bodies. So European procurement means publishing, purchasing of healthcare, how you deliver value in medtech. So make sure that you know those reports before you start. We mentioned Sightline. They do amazing reports about a segment. So they'll have a report on neurology in Europe, and they will have interviewed 10 physicians from 5 countries in Europe, also China, Japan, US, and then they review all the results with their advisory board. And it's really a Bible on what you need to know on a specific therapeutic area. And it's really, really well done. So they do their own primary research. And those are great reports that if you buy them, you'll look at them for the next 3 to 5 years. And then last thing I want to mention is the journal, which also belongs to Sightline now. Sightline bought MedTech Insight, and it's really the best journal for medical technology news and on Europe, both from, the business perspective, strategic alliance perspective, market approval, science perspective. They cover everything. So it's a great journal. So in terms of primary research, maybe I just want to say that I think in China, you have a very developed online media segment. Also in Europe, we're starting to do social media monitoring or social media listening. So you can actually, especially if you have a consumer-facing product, you can listen to what people are saying about your product. You can do online surveys through, pre-prepared survey approaches. So there are very good software, customer KOL interviews. We recommend doing focus groups after you've done the opinion leader or customer interviews to confirm or to review a result. And then choice modeling is about, finalizing a decision that you're going to make. So we go from exploratory to confirmatory. The primary research, for innovators, one-on-one is great. Of course, we do everything remote. Don't worry too much about the sample size. It's better to focus geographically or by segment. So only interventional neurologists in France and in Spain. So you really get the good information on that. rather than trying to go too wide. And then, it's important to connect with those opinion leaders so that you know how they're going to support you during product launch. I always recommend, working with a professional agency because it's not easy. The professional agency, like we can do, is, you make sure you have the best methodology, recruit the right target audience. We always do blinded research. We never say who we are doing the research on behalf of, so that we can be sure that there is no bias. You have to ask open versus closed questions. If you get too many yes and no's, you don't understand anything. And very important is how you're going to present your product. If you present your product differently to different audiences or in different interviews, then it's, bad information in, bad information out. You need to really have a standard description of your product, which is typically an infographic with a few bullets. Very hard to do. Probably the hardest part of the research is designing that infographic. And you got to make sure that the question flow is correct. We'll talk about that a little bit more as we come to the close of this session. And then you need some experience to interpret the data. So imagine, building a building or doing something without experts, it would be really scary. So the investment is well worth it. We do encourage you to get that solid market insight so that you can plan your European launch appropriately. Okay, so just some practical recommendations as we close here. How do we, get and interpret that data? So I'm going to summarize here what I recommend for in-depth one-on-one, interviews with key players in the market. Make sure that before you do that primary research, you get all of the secondary data that's available, whether it's free, such as, a McKinsey or a Deloitte report, or whether it's something that you're going to purchase. So even Pharma Intelligence, even Sightline, they do have free podcasts. They do have free downloadable white papers. So make sure you get those. Prioritize questions that are not found in the medical literature. I've seen people that are asking doctors about outcomes that are already published in the medical literature. You don't want to do that. Maybe you want to confirm it with them. Maybe you want to get their opinion, but you don't want to ask what's already published in the literature. Prototype. I'll show you an example. This is what I meant, is the infographic, very hard to do. Focus on expert interviews initially, and then later you can always move to other audiences. Make sure you get the person to speak a lot. Don't ask the type of questions they can say yes, no, maybe. Get them to talk, right? Get them to explain what's important to them. And make sure you have an interview protocol. It's like a medical protocol. It's a series of questions. It's well-defined. It's standardized. And that's it. Oh, I think this is the wrong direction. Okay, so I'm coming to the end here. So when you actually do an interview, there's 4 key sections. The first section is all about the doctor, the hospital, the medical unit. You discuss what their background education is, and also what job they do and what they experience in their clinic. You never, ever start talking about your product first. Then you explore problem and opportunities. What are the opportunities in my hospital? What are the problems with my patient? What is important to you? How do you make decisions? Who has to approve when you purchase something? How do you expect this market to evolve? And then start to derive implications based on what you heard in number 2. So you test various approaches. And finally, at the end, you actually show them your product and you get them to react. And this is just an example. It's a sample for illustrative purposes. This is an example of testing a product. And like I said, it's the hardest part. You'll probably redo this 10 times before it will be perfect. And then the objective is everybody to understand right away what you mean. And the last thing I want to show you before we summarize is that you can also do price testing. And here you can see some research that shows, according to Westerdorf pricing, analysis. It's a way of doing it. You look at which price might the product be too expensive, at which price it might be too cheap. And when it's not seen as a bargain or not expensive, an intersection of those lines between not expensive and too expensive, and then that's the highest price range, and then between too cheap and not a bargain is your lower price range. And that way you can really determine a price that doctors, purchasing units of hospitals will think it's okay. All right, so to summarize, just 3 things. Be sure to leverage the secondary research, be on top of any intelligence that your partner will have when you discuss with them. Derive implications from that secondary research to inform your primary research and use it to prepare your negotiations. Do your primary research before you close any partnership discussions. Know the value that you provide to really negotiate the best deal that you can, and make sure that your product can stand out in a crowded market. A lot of solutions out there, positioned correctly, you will find your niche. And then finally, ensure that you can have that strategic market entry. With the research, you can decide which country to go to, where I can get the best reimbursement and market access, and where can hospitals most easily purchase my product. So get ready so you can be successful when you choose to enter the European market. Thank you very much.
Okay, great. Thank you so much, Marta, for your insightful overview on how to plan European market entries through a proper market research. Now, actually, I want to report in our Zoom meeting that we have now reached already 1,155 audience from China watching our live stream. Really great, and really appreciate our expert sharing their experiences. So from here, I have a question on Marta regarding value proposition of the product. So there is a growing trend of value-based healthcare in Europe. Could you please elaborate on that topic for our audience to improve their market research?
Yes, thank you. Excellent question. So what we do is we map the patient journey when they undergo treatment with the current standard of care. And then we map the patient journey when they undergo treatment with our new product. And we compare, so to determine the value, we compare to say, where do we save time? Where do we save steps? Where do we save procedures? Where do we perhaps bring more money to the doctor because perhaps he is charging or getting reimbursed for some procedure? So we really compare the value provided of our product versus standard of care. And then that is how we derive the value. And that's how we then use that information to define the value proposition, which is associated with a euro price. So there's 3 ways to price, right? We can price based on our cost. We can price based on the competition, but those 2 are just informations that we use. We price based on the value. So let me use a practical example. So let's say that you are selling a new procedure to do neurorehabilitation post-stroke, and you know that the hospital can receive, in Switzerland, 1,100 francs a day, and your procedure is shortening the in-hospital rehabilitation. They will not want to buy that because they can keep the patient for 5 days, no questions asked, and get 1,100 francs per day. So what you really need to do, like I said, is understand how you fit in the flow and make sure that you understand where provides value to the doctor and to the hospital so that you can pitch the correct value. So map those patient journeys and derive the financial implication of the patient journey.
Great, Marta. Thank you so much, Marta, for sharing your